Here in Montgomery County, Dr. Robert Dickinson, who is the Hospital District Medical Director, Dr. Dixon, and Alicia Williams, the Director of Public Health, Jason Millsaps, who is here as my Chief of Staff and also our new Director of Homeland Security and Emergency Management, and Dr. Bo Reese, who is the Superintendent of the Montgomery School District. As we talk today, if you would hold your questions until the end, because we want to make sure that we answer all your questions. I know that there's a lot of things going on here. There are a lot of moving parts, and so you're going to want to have some questions to answer, but much of that are going to be answered as we discuss what's going on. Now, at about 4:12 yesterday afternoon, we received notification that Montgomery County had a presumptive positive test for the coronavirus at a local hospital. Now, that patient was a male. He was in his 40s, has been receiving medical treatment. At this time, we are still awaiting the CDC for confirmation. Now, whether or not the CDC either does it positively or negatively, Montgomery County and the Health District have taken steps to mitigate further spread from this patient in the community. Now, we'll tell you that beginning in January, our Department of Homeland Security, Emergency Management, Montgomery County Public Health District have been working together with state and federal officials and have been paying attention to what's going on and implementing our response plans. We've been actively monitoring a number of individuals, potential patients, who have all been cleared until yesterday's positive result. Throughout this process, we've been updating our health professionals across the county on new information and the things that they need to look for to identify these issues in patients. These processes have produced, as I've mentioned, several persons under monitoring and persons under investigation. We have worked successfully with those individuals, identified them, and ensured that they were either self-isolating, or that they were staying away from others that they could possibly spread this to while we watched for symptoms. Those who were investigated also received tests, which, as I mentioned so far, had produced negative results until our recent confirmation or our recent presumptive positive yesterday afternoon. Now, so you know, this presumptive positive person was not currently known to us at the time and was not under any monitoring or investigation. He presented to the hospital with symptoms. Doctors began a course of treatment that included testing for coronavirus, which was how they found it. Now, we'll tell you this. At this time, although we certainly do not want in any way to downplay the seriousness of this and are taking every precaution as our Homeland Security, Emergency Management, and Health District and Health Department, the general risk to the general public is still very low. Folks who have underlying health issues, though, and are of some age, are elderly, are the ones who are at greatest risk and susceptible to the virus. And it is our suggestion that they take the precautions that are necessary to avoid contracting this virus. Now, what can all of us do? You've been hearing this all week long, and we can't say it enough, and I'm going to say it again. We're going to start off first. Everyone you can help or slow this coronavirus by doing the basics, just washing your hands. Don't just go in and get under a sink and just let the water run on your hands and then wipe them off. Wash your hands with soap and water, with warm water, for approximately 20 seconds, as the doctors have told us. Use an alcohol-based sanitizer. Carry it around with you when you don't have an opportunity to wash your hands, so make sure that you're germ-free. If you're sick, stay home. Don't go to work. Stay home. Call in. Your employers are going to understand it, and certainly everyone else around you is certainly going to want you to stay home. Also, avoid public places. Now, when it comes to your coughing and your sneezing, don't just cough and sneeze. Don't just put your hand over your mouth. If you just put your hand over your mouth, yes, you're going to keep it from going anywhere. But if you do have it, you have the chance of, on your hand, you have the chance of contracting it through your eyes, through your nose, through your mouth, whatever. Cough into your sleeve or cough into a Kleenex and discard it quickly. These are just some very basic things that all of the health professionals have been recommending to us. Please know, however, that our Emergency Operations Center is fully staffed. We are ready to provide assistance and resources to all of our first responders, to our healthcare professionals and the public health district as needed. Now, I'd like to introduce to you Melissa Miller, our Chief Operations Officer of our hospital district, who's going to come and share more details with us. Melissa?
Thank you, Judge, and good morning. I wanted to share some of the more details about this patient and what we've been doing as a public health district and hospital district within the county. This 40-year-old male who is a resident of Northwest Montgomery County came to us, as the judge said, as a presumptive positive case yesterday. We are still pending the CDC confirmation of this case. This gentleman has no travel history outside of the state of Texas, and our epidemiology team immediately began an investigation once we received these notices. All the close contacts or people at risk from this gentlemen have been contacted and are self-quarantining and are being monitored by the public health district at this time. Many questions have come up about how many are under monitoring. Since we began monitoring patients on February 7th, we've had 39 current under monitoring. 21 of those remain under monitoring. Persons of interest, those that are being tested for this disease, we've had a virus. We've had 14 of those, 8 of those are still under investigation. We monitor those that have travel or airline history or in close contact with a known case. Persons under investigation are those that are symptomatic and have been tested. Those are the definitions of those. Montgomery County Public Health District's aim is to keep the public updated with information as allowed through compliance with HIPAA and privacies of the patients. We will continue to update the media as well as the public through our Facebook page and media releases of any other presumptive cases that come forth, any positive cases confirmed by the CDC, or should we have a Montgomery resident that passes away due to the coronavirus. And at this time, I'll hand it over to Jason Millsaps.
Good morning, I'm Jason Millsaps. I'm Judge KHOU's Chief of Staff. I'm also the Emergency Management Coordinator for Montgomery County. I want to reiterate what has already been discussed today. The Emergency Operations Center is fully staffed and we're ready to respond to the needs of our healthcare workers, our first responders, and the health district as resources may become necessary. We've been working with our state, local, and federal partners since the mid-January timeframe, preparing for this since the onset of the outbreak in China. The Office of Homeland Security Emergency Management encourages all of our residents in Montgomery County to practice good hand washing techniques, follow the guidelines that have been prescribed this morning and through news media about hand washing. Additionally, we stress the importance to receive and share only information from trusted sources, legitimate sources such as your elected officials and official public agencies. Spreading misinformation overwhelms our response efforts and causes unnecessary panic and hoarding. Resources are very limited at this time, so please keep them available by sharing only important information and keep everybody to remain calm. You can get up-to-date information by visiting the Montgomery County Health District's webpage or follow your Montgomery County Office of Emergency Management and Homeland Security's Facebook page and Twitter. We'll provide daily updates as they are necessary. If you are sick, please stay home. If you need to seek medical treatment because you are sick, please call your doctor or your healthcare professional or the hospital prior to showing up there so we can prevent further spread of this. If that is the case, please notify them and they'll tell you step by step what to do. Judge.
This time, Dr. Bill Reese with the Montgomery, Superintendent of Montgomery School District. Dr. Reese. Slide down, please. Yeah, thank you.
Yes, good morning. Out of an abundance of caution, the Montgomery Independent School District will be closing early for spring break starting tomorrow, which is Thursday, March the 12th, and Friday, March the 13th, for deep cleaning of our campuses and schools. This will move the district's protocol into, again, closing school, as well as canceling travel and events for students, as well as we look at ways that we can protect the safety of our kids and our staff, and ensure that, again, out of an abundance of caution, that we're able to go in and deep clean our schools. We contract with a company, SSC Services, which is a national company, to do the cleaning of our schools, and we have been in close contact with them on different protocols to begin utilizing to ensure that any virus or any spread of any type of illness will be contained within the deep cleaning of our schools. So, thank you.
All right, thank you, Dr. Reese. At this time, are there any questions? We're going to entertain questions that you might have. We have healthcare professionals with us and the rest as well. Yes, ma'am.
So if he didn't travel outside of the state of Texas, how did he contract the virus?
Melissa?
He is still under investigation through the epidemiology team with the Public Health District, who coordinate with Houston as well as state and the CDC, and at this time I don't have an answer to that question.
Could he have possibly come in contact with another person?
Anything is possible. Like I said, this is under investigation and I have no other further information to share.
And to be clear, Melissa, this is not community spread at this point, simply because you guys don't know.
Correct.
You mentioned a few minutes ago the statistics about how many people were under supervision. Can you share with us exactly the statistics you have right now? You mentioned 39 people.
Right. Since February 7th, we had 39 under monitoring. There are currently 21 under monitoring. People under investigation, those that have been tested, as the Public Health District has been notified of those tests, there have been 14. 8 of those tests are pending results. As of 9 a.m. this morning, that's the latest we have.
The rest came back negative.
Yes, sir.
Does the 40-year-old have any connection to any of the cases of the Egyptian, the people who traveled to Egypt,
As I stated, this is still under investigation.
or any connection to the school district, or is this just, you're just closing early for cleaning?
We have talked to our local health authority, Dr. Charles Sims, and shared this case with him, and he has not recommended any closures of schools nor businesses in the county.
Yes. Representative Toth.
Any underlying health issues with this 40-year-old?
Out of HIPAA and privacy concerns, I am not going to release his health history.
You talk about how the risk is generally low. Is there any type of presumptive positive case that would elevate that risk? Because we've heard that
Doctor?
the risk is generally low for all these presumptive positive.
Dr. Dixon's with us. Doctor, why don't you come on up and answer that question if you would?
Thank
That
you,
way you
Judge.
get an accurate answer.
So for the COVID-19, this particular subset of coronavirus, it affects mainly people, adversely affects mainly people with severe underlying health conditions to begin with. So patients that are immunocompromised, have diabetes, they're infirm in hospital or nursing homes, things like that. The overall risk, I'd like to reiterate, is quite low for the general public, and especially in the younger subset of our school children, the risk, although present, and we're preparing for that, is very, very low.
Question for the judge or the superintendent. Can you give us a little bit of insight about the decision to close schools early?
Dr.
And
Reese?
is that something that other districts are considering? Why Montgomery?
I'm going to refer that to our superintendent, who is right in the middle of that whole deal.
Yes, just again, out of an abundance of caution and the opportunity to do deep cleaning. To my knowledge, we're the only school district in Montgomery County at this point that is not on spring break. And so we have these 2 days for a little early exit for students and staff, and it gives us a little additional time to ensure that we are able to hit all of the facilities in the district with deep cleaning that includes wiping down all areas and surfaces that are common areas that people may touch, as well as in classrooms being able to use hospital quality disinfectants across the district so that we can ensure the students' safety and as well as the staff. And at this time, we do plan to reopen on Monday the 23rd, which is our normal date for returning from spring break, unless we hear of other circumstances that arise or other issues from the health officials.
There's not a chance that this 40-year-old patient is related to any schools, right?
I'm sorry, repeat that question.
Is there a chance that this 40-year-old patient is
Melissa?
We're not sharing information about this person's family or close contacts. Those close contacts at this time that we have interacted with are asymptomatic and are staying at home and self-quarantining. So there is, at this time, no risk of them spreading any illness should they become infected.
Melissa, before you get away from there, presumptive, a lot of people still thinking it's corona. Explain presumptive.
A presumptive case is one that tested positive at our Houston labs. Those tests are very complex, and so they are sent to the CDC for a confirmation testing to ensure that a confirmed case is actually a confirmed case.
This is just presumptive.
This is just presumptive at this time. We do not have the CDC's confirmation of a positive.
How long has he been symptomatic, and where is he now?
He is in a Montgomery County hospital.
And how long has he been symptomatic?
I'm not going to share the information.
When are you gonna be receiving the confirmation on this patient?
We expect to receive that confirmation in the next 48 hours,
48 hours.
or that it's not positive.
Yeah.
You've been so patient. Go ahead.
I'm sorry.
I understand, it is my understanding that the CDC just changed a criteria, and I don't know if you can address that. It used to be 60 and over with an underlying condition. It is my understanding that as of yesterday, it is now all those over 60 may be at higher risk. Do you know what, if I'm reading that correctly, do you know what caused that change?
I'm going to allow our public health experts to answer that question because they are more readily.
Thank you, ma'am.
So we don't know what sparked the change. We just know that with more time and more investigations and more data, there will be changes. And so just like whenever we first started, we had just limited travel to China, then it was mainland China, and then that was expanded. And so as the need increases, the criteria will change.
And then in addition to that, it is impossible to find the recommendation by CDC is for hand washing and then use a hand sanitizer when hand washing is not an option. Is anybody able to tell me where you can find hand sanitizer? Because it's not out there. And the local stores will tell you they can't get it. I mean, Walmart, Target, Kroger's.
Yes.
I was just at Walmart this morning, and they don't even know if they're gonna get any more in.
Yes.
So that's that's.
It is a concern. Most of the suppliers, we've had several calls about this same sort of thing, whether it be toilet paper or sanitizer. And so we know there are shelves that are empty. People are panicking, and that's not what we want.
Right.
So we need to have those items available for people who truly need them, as in like masks and things like that, who truly need them. And so we would encourage you not to hoard up the supplies, but I understand that's already happened, and I don't know, I don't have any idea of when the manufacturers will be able to supply the demand.
I want to ask a question for the
Hey,
superintendent.
Judge,
Representative Toad.
the CDC has a recipe for you to make your own.
And you can't get that.
But you can get Everclear 190 proof grain alcohol, which you can buy in the store, and that will take the place of isopropyl alcohol. So as long as the alcohol is 190 proof, you're good to go.
Thank you for mentioning that. It's actually anything above 120 proof
Okay.
will work in making your own hand sanitizer. But the best thing to do is good old-fashioned soap and water, scrub your hands, sing the happy birthday song twice, pat your hands dry.
What's this man's current condition, and at what point does he get released from the hospital? What's the policy on releasing him and trusting him to
Doctor?
quarantine?
If you like it, if you would.
Can we say that?
He is in stable condition at a local hospital. He will be released at the time that his physicians have determined that he is eligible for release.
So stable's not a condition, is it fair or good? Stable just means it's not changing from
That's
serious
good.
to good.
Stable.
That is the information we have been given from the hospital. I can't go into I can't tell you anything that I haven't been told.
Given that the test hasn't come back positive, or the CDC hasn't said it's positive, can you just address people's anxiety about this? Because they're gonna think, is this the first case of community spread? Is this a possibility? what would you say to people out there who are like, whoa, this makes me feel anxious?
If it is positive, it very could likely be the first community spread. And so that's one of the reasons we're waiting to get the confirmation before we release any more information about that. And so in response to your question, I also wanted to say there are discontinuation criteria for him to become out of isolation from the hospital, and he will have to meet that before he's able to be discharged.
We have.
For the superintendent.
I'm sorry, Beth?
You have the fair and rodeo coming up. Any concerns about that?
Jason, you've addressed that with those in charge. If you would answer that, please.
So the local health authority, Dr. Sims, at this time is not recommending those things. This is a fluid situation. Things could change. We are in communication with not only the Fair Association, but Ironman and other events that we have planned in the next 60 days throughout the county. And they are aware, as this is a fluid situation, that we may be bringing updates to them to make those recommendations. But the health authority would make that decision, and we would implement it. And at this time, he's not recommending that. So.
You know, to address the issue that you brought up about just putting people to rest, I'm not sure really how to do that, other than the fact of the actual issues that we have told over all this time. We have one presumptive positive. Could that develop into something? Well, of course, any reasonable person could say that. While at the same time, our health officials, we have deferred to the professionals, those who have excellence in this area. We've got the finest health professionals, I believe, across the state of Texas, especially in the development of our medical community, and we are listening close to them, and as Jason has said, we'll implement that. Now, whether or not that gives people any security or a spirit of calm, I'm not sure, but it is something that absolutely, that if we're intellectually honest, we have at some point the requirement, we must dial down the emotion on this issue. And that's where all of you come in. You can help us with this. You can either dial this deal up, and in my experience with our press and all of our area in Houston and surrounding areas, you guys are balanced, you're fair. I think that you understand the needs here, and we ask that you cooperate with us in giving accurate information on this, and without the desire to just continue to dial it up. And so that's been my experience in the past as we have done this before, and I believe that's probably going to happen now. Are there any other questions that we had? Yes.
The business that, I guess, wherever he works, are they also being told to quarantine? Are they cleaning the place? What kind of precautions are they taking for?
Melissa, if you would.
His employer is aware. He was made aware by the patient himself, and they are taking the precautions necessary to protect their other employees.
Are those people being placed in quarantine?
Those patients are not, those employees are not at risk based on the contacts he had with them. Only close contacts that would be at risk for developing the infection have been put, the virus have been put under self-monitoring.
You've been patient as well. Go ahead.
Thank you so much. This is a question for the superintendent.
Yes.
And possibly something parents might want to know.
Dr.
We've
Reese.
seen other school districts that were addressing absences or self-quarantining following spring break. Is there any change to policies that parents should know when students return?
Yes, we will be communicating that to parents today with our information going out about closing school and just an abundance of caution. But we are going to work with parents on if they feel like they want to keep their child at home, then we will excuse those absences and work with them to get them the work so they can get that made up. But we do have provisions in place for that, and we're also working at the high school level. We have some incentives for attendance that are tied to exemptions for final exams, and so we're working to remove that just so that students, sometimes they might come to school sick so that they don't have to take their AP biology final. So we want to make sure that we remove any concerns of that nature from our parents and kids.
So it'll be excused if they choose to stay.
Yes, ma'am.
To clarify, the city of Houston did the first test, not here in Montgomery County, the city of Houston?
That's correct.
Yes.
I don't know if you are able to respond to this. We have many presumptive cases in Montgomery, County, Harris County, and now we do. So according to the CDC, it just takes 48 to 72 hours. But we didn't have any response yet about the presumptive cases. So do we know why?
No, we do. That's a function of the CDC and when they get the information back to us. As you can imagine, given the volume across the nation, especially being accelerated in some areas, but I will tell you they are on it, and we're in contact with our Department of Health Services here in Texas, who's also in touch with them, as we are as well. So we're on it, and as soon as we get it, our commitment is to let you know, just like today, that we had committed before, that as soon as we get a presumptive positive, we will let the community know. That's exactly what we're doing today. But thank you. Yes, sir.
Just to be 100% clear, those 21 people currently, are they directly related to this one presumptive positive case, or these people were under monitoring before?
These are people that have been under monitoring before and some that have been in close contact with him.
Jason, if you would.
To add to the question earlier about the presumptive positive in the CDC, while we're waiting on that CDC confirmation, there's a reason why the protocol calls for this isolation. We treat this as a confirmed case, even though it's not confirmed, because we can't wait the 48 to 72 hours and then hope that it spreads. We got to shut them down, isolate them, and start making contact with everyone they've come in contact with to do the same to them as well. So as we progress, if we have additional confirmation, or excuse me, presumptive positives, we'll treat them the same way as while we're waiting on the CDC confirmation. So that's our local protocol that's been in place for some time.
Yes.
Judge, I think it would be good to put in perspective that not every respiratory illness or pneumonia that's erupting this season is going to be the novel coronavirus, COVID-19.
Correct.
That we're facing an epidemic of flu, and it is targeting young people this season, whereas coronavirus is targeting over 60, over 65, even more. So we need to keep that in perspective when
Yes.
it comes to focusing on closing down or canceling any kind of work or school or conferences, events, etc. Because we really
Yes.
should keep that in perspective. This is a terrible flu season, and it is hurting young people and causing deaths in that younger population.
Yes.
Whereas the COVID is avoiding young people, and to my knowledge, it hasn't caused any deaths in young people in the United States.
It's a great point, Dr. Gibbs. We appreciate it so much. I will say that one of the things that, as you mentioned, we're in the middle of flu season, and it's dialing up, it looks like. Not to mention, we are having an unprecedented early amount of pine pollen that is, everybody in this room is trying not to cough into their hand. I'm watching people going like this. Thank you very much, what you're supposed to be doing. But you have a lot of, there's more moving parts to this, that just the seasonal element of this and the unusually mild winter that we have had, and then going into the springtime. And so, Dr. Gibbs, to your point, that's an excellent point. Thank you for that. Are there any other questions that we might have this morning? All right. In closing, I want to thank you all. Thank you for joining us this morning to help us provide these details to our residents here in Montgomery County. As we receive additional details, you can count on us to get you the additional information. Also want to let each and every Montgomery County resident know that we are in constant contact with the region, with the state and federal leaders to ensure that we are up to date on all the information we need to identify and deal with this crisis. Also, I want the people of Montgomery County to know that we, in our area, as I mentioned before, we have the very best medical team, the very best doctors, healthcare professionals, first responders, and elected leaders, I believe. And we have a couple of them here with us. Dr. Shelley Sekula Gibbs here with the Woodlands Township, Steve Toe, State Representative, Brandon Crichton, State Senator, is with us. We thank you all for joining us today. And everybody is working tirelessly, I'm telling you, tirelessly in response to this as well. And we will be in touch with you. Please practice clean hands best practices based off the guidelines discussed earlier. Thank you all very much, and we will be in contact with you.